What's up, guys? Great morning, great morning, great morning, Houston, downtown, midtown, third ward, fifth ward. Those of you listening in the car at 102.5, and those of you that are tapped in through our free KMAZ app. I'm so excited right now. I have some beautiful ladies in studio with me today, and they are friends to the station. I'm gonna ask you first, Lashana Moore. Give me three words to describe you.
Oh, I am a woman through and through in all things. I am a friend and I am an advocate. That's how I would describe myself. And good morning.
And good morning. Dr. Taria.
Good morning.
I said it right.
Yes.
You did.
Dr. Taria Richmond. Give me three words to describe you.
Innovative, trailblazing, and a woman of God.
I'm glad to have both of you in the studio with me today for good reason. We have been going back and forth about this discussion that y'all are having online. When I seen y'all make y'all's post, I said, oh, nah, I got to have them in the studio with us today. We need to talk about what's happening or what has happened with influencer Jessica Petway.
Right.
I saw that she recently passed away due to a misdiagnosis. She was originally diagnosed with fibroids, right. And then come to find out she ended up having stage 3 cancer. I know that you ladies are tapped into in the medical space. Dr. Taria Richmond, Lashana, I know you do a lot of discussions around mortality and Black women's health and things like that. What do y'all think about what is going on here? What about it? It almost seems like I've been hearing the discussion about Black women going in a hospital and not coming out.
Yeah.
It's almost like the browner you are, the worse the chances are worse for you. What do y'all think about this?
So, what do I think about this? First of all, I would like to extend my sincere condolences to her husband, her kids, her family, our community. This is deeply saddening. I started following Jessica back when I was doing like natural hair fashion shows, and just to see that at 36 years of life, she's passed away by a disease that was actually preventable. And so I feel like we've come very far, but we've gone really, really far back in the health of women, in the health of Black women. So I'm saddened by it, but it also, I think, has sparked us to have more conversations so that we can advocate for ourselves and take better care of ourselves.
Absolutely. I agree with you. It is yet another devastating, and you never want to. This is not an encounter that we want to get used to. It's a devastating encounter. My heart goes out to her family as well, her journey and the portion of her journey that she shared with us. I echo the same thing that you say, Dr. Taria, in that as much community that we're building in women's health, and particularly Black and brown women's health, and even more specifically Black women's health, it feels like there is still such a ways to go. And hopefully with this conversation today, we can kind of bring things back to the basics so that our women can better understand conversation with their medical team, as well as understanding their bodies and what the proper protocol is for them.
When I go to my doctor, I just want to, especially when it's women's
wellness exam.
I just want to get in and get out. I'm not trying to have all of these conversations.
Why not?
For what?
Really?
Literally.
Oh,
so as long as I'm healthy and I know my results, I'm out of there.
So okay. So you have to think about
Am I wrong?
Well, I'm not
break
gonna,
it down.
I'm not going to say you're wrong, because you have a right to, you have autonomy, right? So you have a right to say what you want, what you're done with your body, what you don't. That's your right. However, we have to look at this like the bigger picture. So for one, as a physician, we're trained, we learn all of these things from our books and then going into clinicals. But how are we able to best assess you and come up with partner and a plan for you if we don't know all the things, right? And one of the number one concerns I get from women, women of color, is that they don't feel heard, they don't feel listened to. So it's a surprise that you're like, I just want to get my examination, the opposite side of the spectrum.
I feel like I'm not the only woman that feels this way, so I'm gonna say it.
And that could be true as well, because there is it could be I have found that it's so many different things for so many different women. Sometimes it's a backstory. Sometimes it's the intimidation of the clinic. Sometimes it's being in the sterile environment, this clinical environment that you feel like, okay, I just let me go in and do what they say I need to do. And as long as they say I'm fine, then I must be fine and let me get out of here.
It feels like going to a ward.
Yeah. And so that, it can tend to cause you to want to rush through the process or not really take as much, especially for us, ownership of your moment. And I think if we start reframing it, this is an opportunity for me to seize a moment that may extend beyond this appointment today.
What if people don't know what to ask?
Let's talk about it.
Yeah, let's talk about that. So what if we don't know what to ask, right? So I think one, having a community helps a lot, right? So we're in the age of social media. So you can literally go in and ask what question to ask when I go to the doctor to kind of give you an idea of what questions you need to know. And then also what you feel, like be okay with. And I know sometimes it depends on who your provider is. It depends on the environment, where if you feel comfortable, if you don't feel comfortable saying, hey, I've been bleeding. Is that normal? Like I'm using 7 pads a day. Is that normal?
Okay. Can I pause you right there?
Sure.
Because that's where with the lady, right? With Jessica.
Yes.
So I went back and read.
Bleeding.
Yeah. I went back and read the comments that she put to share her story.
Right.
And she said in the comments that she was bleeding so much.
Yeah.
Like bleeding out.
Yes.
And them people was like, oh, well, that's fibroids normal. And sending her home. So even if I'm asking the right questions as a Black woman,
right,
I'm still gonna get sent home.
It has become a generational, a cultural norm. As young as we can remember, cramps were fine. Heavy bleeding was fine. Automatically going on birth control to control your periods were fine. As far as young as I can remember, my classmates, that was the norm. And so now we really are having to take more assessment and accountability for, I have to probe deeper in this.
What is fibroids? Like what makes it do that? I don't know. I'm not a doctor.
Right.
What makes it bleed like this?
So fibroids are non-cancerous growths on your uterus. So the uterus is the womb. That's where if we carry a baby, that's where the baby is. That's where our menstrual cycle actually, the lining that comes out is actually what the menstrual cycle is. And so the fibroids, they function and cause heavy bleeding. We don't know everything about how fibroids function. We don't even have a full understanding of why, certain people, particularly Black women, are more prone to fibroids. And so we're still digging, we're still learning. I do some clinical trials. One of the things that I recommend is if you have fibroids and you can be in a clinical trial, that helps us gain more information.
That's good.
And so we're very underrepresented when it comes to clinical trials and research. So a lot of the information that we could get, we can't because we're not necessarily participating. And I wanted to go back to Jessica being, says she's having this heavy bleeding. So I think it's true. So culturally, we've always said, well, that's okay. That's normal. I can tell you almost every day I have women come in and say, and I'm asking about their cycle and that's normal for me. I'm passing clots.
And tampons.
I'm wearing pads and tampons and I'm still bleeding through, but that's okay. I just don't go outside for that day.
Right.
That's normal for me. And I'm like, hey, that's not normal. We have to do more. And so from a cultural perspective and then a system perspective and access. So it's not clear to me for Jessica if most of her visits were in the emergency room, if they were with the primary care, were they with the gynecologist. But I will say from a system perspective, even in the emergency room, I have seen a stage 3 cervical cancer before.
What does it look like?
It looks like a fungating, almost like a or like a rotten orange or coming off of the cervix. And I'm glad you brought that up, and I won't take all the time, but I just wanted to share my little.
People in the car.
This is a model of a vagina, and internally, I just wanted to show where's the cervix. And so when we do your examination, and we'll talk about what's the difference between a pelvic and a pap. When we do your examination, we actually are inserting the speculum, that little plastic, sometimes metal tool, into the vagina. And when we go in, we can actually see your cervix. So this is the cervix. It doesn't come out, y'all. It's attached in real life. But this is the cervix, and this is where we take the cells for the actual pap smear. But literally, in an emergency situation, I diagnosed a stage 3 cervical cancer because it didn't look nice and pink and round. It looked like a large mass. So if someone had, even in the emergency room, when they're talking about systems and physicians and providers, if they had just taken a look.
But okay, is that something her husband could have seen? Because I saw even too in the post in the comments, she said the doctor asked, "Can I look down there?" So is it something you just see with your regular eyes, or like do you need
So possibly,
I don't know if this question makes sense.
No, it absolutely
depends.
does.
It depends on how large the cancer has grown. But for the purposes of being able to diagnose and see, typically you have to insert the speculum and open up so that you can see. So it's just not always readily seen in the actual vagina.
Listen, this is KMAZ LP Amazing 102.5 FM. This is really good information. I'm looking at y'all because I'm really learning right now, and I don't want to sound silly.
Absolutely not. Absolutely not.
And maybe that's why people don't like
necessary. Yes, it is.
We don't want to sound crazy.
It is necessary. We have to tell the fundamental part of self-advocacy is understanding that there is no silly question, that you have the right to explore and be just as inquisitive about your body, your body's health, how your body works and functions, just like anything else that we would advocate for. And I don't know if we need to say it, give a disclaimer to this conversation or anything like that. But I always encourage young ladies to build a relationship, that you're your first doctor, even in the sense of you understand when something is off or something is not right, something
and
is
maybe
going
that's
on
why
with your
I
body.
Really sat with my physician because
you don't have
I've never had a issue. You know what I'm saying?
So it is twofold.
Yeah,
if you're not feeling anything or seeing anything, or first of all, paying attention, smells, sights, discharge is not abnormal per se, but understanding your cycles of discharge. But then also the other spectrum of that is not just waiting, because we want to do preventative care, not just waiting for something to be awry, but asking questions like understanding the difference between the well woman exam, the pelvic exam, the physical, your annual physical. Like Dr. Taria, with my clients, I have a lot of women who are ashamed of not knowing the differences between those three. And if you don't, you're not empowered to ask your doctor, because let's say you don't go to the same doctor all of the time. So the doctors are going to have a different experience with you or an understanding if they don't know your background or your medical history. Understanding when you go to the doctor, questions to ask.
Well, Dr. Taria, what can the physicians do? Because if I'm somebody that don't know how to ask the question, and you rushing me out, well, not rushing me, and I'm not saying you particularly, but the time that's physician, they're like, hey, okay, you're such, they're looking at the clipboard, hey, you're such and such, good, you good? Okay, good, let's go.
So, and that's how we miss things, right? For me personally, I'm in private practice for that very reason. And my staff are like, Dr. Richmond, you're taking so much time, but it requires, it's so necessary. Do you know how much I now posted this on my Instagram, Dr. Taria? I posted hey, physicians, we got to get back to the art
yes, ma'am.
of medicine.
Yes.
You know, medicine right now, and we talk about systems. So let's look from the perspective of access, like being able to have the doctor that you feel like works for you versus being assigned a doctor. This is kind of our system and where we're in, right? But when you go to the doctor, I say give them a little bit of benefit of the doubt, especially if they're in a large system, because they're tasked to see patients, get in and out, like literally all of that is monitored. So they're trying to keep their job and live, right? But at the same time, we have to get back to the art of medicine, and that is taking a thorough history. That means listening, and then doing a physical examination. I think we're in a world now where we have so much access to imaging and the latest and the greatest, and a lot of times things can be diagnosed just by listening and doing a physical examination.
That office visit.
In the office visit, you know, over 12,000 women are diagnosed with cervical cancer a year in the United States of America. 93% of those cervical cancers are preventable.
And that's the known number.
That's the known number.
Y'all act like y'all know what y'all talking about.
a little bit. You know, we passionate about this.
Yes, indeed. Yeah,
I could tell. Okay, listen, I want to talk about, if we have some talking points here. We're going into what we're saying with the young lady. And again, as you mentioned, condolences to her family and all of that. We talked about educating yourself, right? Asking the right questions, the relationship with the medical team.
That is important. Not to feel uncomfortable, not to feel intimidated.
And then we talked about advocacy basics. Did we talk about that?
Not in detail. We touched about advocacy.
Okay, what can you all say about that? What are the advocacy basics?
I say speaking up, but also leaning on your community, having someone that, let's say maybe you're a shy personality, having someone with you that can speak for you. And on our website, the film's website, Black Bodies, because we talk about, you know, the racial equity that is needed in healthcare and advocacy, knowing your patient rights. So educating yourself from an advocate standpoint by saying, first of all, let me see what are my rights as a patient, your plan of care, your power of attorney. Those are things of empowerment, because if you don't have if you're intimidated when you're in your doctor's office, then you need to know what questions to ask. I'll say journal them, write them down. Prepare for your visit. So if you are, you know, if you're not going to someone who has a medical practice like Dr. Taria, where she is spending more time, you maximize the time that you have with your doctor by the questions that you have written down. That gives you a sense of empowerment, and also opens up dialogue with your physician.
Now, Dr. Taria, you were talking, you have a point here about anatomy education. We just did a little bit of that. And pelvic versus pap smear and HPV.
Yes, let's talk about that.
Yeah. So one other way for advocacy too, I wanted to say is remember that you whether you pay for insurance or not, that you are the customer.
Yes,
right. And so as a customer, you have a right to choose.
Yes, ma'am.
So if you come to me and I'm not offended, if you come to me and you're like, Dr. Richmond is not my doctor, like she, or I don't feel like she listened to me, or that diagnosis or what they're saying to me doesn't make sense.
Right.
It
I don't
is
understand this
okay.
medication.
Yes.
Why am I taking this?
It's okay to go to another doctor.
Say it again.
It is okay to go to another doctor.
Why do you think people don't think it's okay?
I think because it's that power dynamic. You know, many days I go without wearing a white coat because I feel like it can put a line in the sand in between. I'm the doctor, you're the patient, and what I say goes. And that's really not the case, right? We have to work collaboratively and partner in your health. And so I think that power, we're getting, as time has gone, we're getting better about trying to close that gap. But if any of the like older generation, the doctor said, you know, I even experienced that with my grandmother. I'm like, okay, so the doctor said that, and why did
it's just because the doctor said
it? And so trying to close that gap, I think, is a part on us as the physicians and the providers, but then also the patients as well. And so we're talking about the difference between the PAP and the pelvic and the annual like physical examination. So the annual physical, so that is your general physical where the doctor does a physical examination from head to toe without necessarily doing the pelvic examination. The well woman's or the woman's examination includes a breast exam and then also a pelvic exam. So that means that we'll take the speculum and we will take a look inside and maybe take some specimens. And then if your pap smear is needed, then we also take which is different, right? So the pelvic is, I'm going in, I'm taking a look, I'm taking specimens. And while I'm doing the pelvic exam, I may also do the pap smear. And so the pap smear is taking cells from the actual cervix to screen for precancerous cells that could turn into cancer. And that's why cervical cancer is prevented,
right?
Because we can catch it early and we can do something. There are some procedures that can be done to take that out so it doesn't become cancer.
Right.
And a majority of cervical cancers, not all of them, but majority of them are associated with HPV, the human papillomavirus. And the human papillomavirus is actually a sexually transmitted virus.
Yes.
And most women throughout their lifetime at some point will come into contact with HPV. The great part about it is it's a virus, right? And when I say great part, I mean the good news is that it's a virus. It actually can go away and not necessarily cause all of these changes. But when it doesn't, then further, maybe more routine pap smears, maybe you might have to have a procedure, but the follow-up is necessary. And we do see a higher rate of high-risk HPV in women of color. We don't necessarily know why that is, but it is the case. And so that's why it's so important to come and get your well woman examination. Now, the guidelines have changed about the pap smear, but you should still come and get your well woman. Somebody, if you are a woman, I don't care if you're having sex, you're not having sex, if you're 65 or 16, you should still have your wellness examination, your well woman examination. So it used to be a long time ago, they just did pap smears on everybody.
Yeah.
And then they changed it to starting at 18 years of age. But the more recent guidelines say start at 21. And not only are we doing the pap smear, but we're also checking for the high risk strains of the virus that could potentially turn into cancer. And it used to be that the pap smear was annual. And I've seen a lot of discussion about, well, why did they change the pap smear? Why it used to get it every year? So the well woman is every year. The pap smear, because of the way the virus behaves, your body can clear it out. Or if it's going to change the cells in the cervix, over time, it takes a long time before it actually becomes cancer. So a lot of women, especially young women who can clear out, healthy women can clear out the virus, were getting unnecessary biopsies. And so that was the logic behind extending out how often you should get the pap smear. But it depends on your age, if you have had positive results back. So there's a lot that goes into it. So that's why it's so important that not only do your screening, but you keep up every year, right? So if they say don't come back for 3 years for your pap, that doesn't mean that you don't come back the next year for your wellness. You still need to come back for your wellness.
That understanding is important.
It is. That's why we're having this discussion today. I'm definitely going to start taking my physicians to lunch.
Build relationship, right?
Because it has been, I think for a lot of people, you want to get in there, put your have your socks on, do your thing, make them check.
I'm gonna have to beg to differ. I tell my patients, I'm like, y'all, I got to get to the next patient.
I know people. Because they want to talk to you.
They want to talk.
I know women that
it's such a good feeling.
I know women that dread going.
Yeah.
I'm serious. They dread going. It just is cold in there.
Yeah. No.
Very sterile.
Yes. And it really depends on where you're going.
It depends on
cold.
When I come, my patients come in, and I see them, and y'all see the meme, hey friend,
right?
That's us,
right? Why you stayed away so long? Why have you been?
No, we gotta wrap this interview up or this segment up. I really appreciate both of y'all for taking time with me today.
Absolutely.
And talk about Black women and wellness.
Yes. Yes.
This is necessary.
It is very necessary. If I may say one last thing, in addition to Dr. Taria asking our women, Black women, to participate in more case studies, I'd like to speak to those women who are out there. At our community, already there is a stigma there with the history of how the slaves were treated. The gynecologist that is known as the godfather of gynecology. We talk about it in the Black Bodice film of how the female slaves were experimented on. So we have a lot of women who are looking at the history that we come from. There is a lot of skepticism when it comes to treatment, when it comes to participating in these kind of case studies. But if we as Black women can speak to you to encourage you to please participate, ask all of the questions that you need, because the more case studies that we have for research, the better off we are in terms of finding solutions and really being able to target treatments and cause as well. Because with Black women particularly, we do have a higher rank in different types of cancers and fibroids and just the percentage rate that we have. So if we can work on unraveling the stigmas, there are women who have gone through abuse. I'd like to speak to them really quickly, who are absolutely terrified of getting just the basics done. I'd like to implore them to begin to work with maybe a therapist or a professional, because your reproductive health, which is not just about children, it's everything vaginal, your uterus, your cervix, your being able to thrive as a female. These things are very important. So if we can work on dismantling a lot of those things, we'll have more of us involved in case studies, more of us going and getting the basics done. A lot of my clients deal with these things.
I'm glad you ladies came in today.
Thank
Dr.
you.
Taria Richmond, where can we find you?
You can find me on Instagram at Dr. Taria, DrTeriya, and all social media platforms. And I'm also, my website is www.yourtotalhealthdoctor.com.
And what's a woman? It's Women's History Month.
It is.
Yes.
What's a woman that has inspired you?
Oh, I have to say Michelle Obama. Yeah. So we're from the same background, Chicago. We went to the same high school, different times, but just to see how she just how well she does just as a woman, and her femininity, how she expresses her love for her husband and all the things, and then she's still a boss.
Yes.
She is very, very inspiring to me.
I like that color on you today.
I know. Isn't it beautiful?
So this is the color of, thank you. This is the color of reproductive cancer. So ovarian cancer, cervical cancer. And I just so happen to have this in my closet, you know.
Did you?
But I looked up the colors and I'm like, yes, this is perfect. So thank you so much.
And thanks for bringing your vagina.
Yes,
oh, yes,
please.
yes.
That was so good.
Education is healthcare.
Yes, it is.
Because I knew somebody.
Shanna. Yes, ma'am. Yes, ma'am. How can I help you, Amanda? What is it?
Who's a woman that has inspired you?
I love so many, but I'm going to highlight Audre Lorde, poet, advocate, outspoken, said the things in her day that could have been threatening to her existence that are very enriching for us today.
How do we find you, LaShanna Moore?
I'm going to direct you to Holistically Well Center, and that's holistically with a W, on Instagram, as well as Facebook. And our website is holisticallywell.co, C-O, no M, but .co.
I appreciate y'all.
We appreciate you too. Thank you for having us.
Thank you. I want more of this. I got
part one. Yes,
part one.
Part one. They've already invited themselves. And you can tune into our platform on our website at amazing1025fm.org, or in your car if you're in downtown, midtown, third ward, or fifth ward. Put it on 102.5 FM. I got more guests in studio. I have some ladies that are coming in today. They're going to tell us why they love women. And I can't wait to have this discussion. So stay